As men get older, we're told that more testing equals better care. But what if I told you that some of these routine health screenings, the very ones you've been told are essential, might actually do more harm than good? I'm Dr. Claire Morgan, and I've worked with hundreds of men over 60 for more than 2 decades. I've seen how some checkups provide clarity, and others only cause confusion. I believe in smart, natural strategic health, not fear-based medicine. Today, I want to walk you through 5 medical tests that may not be helping you anymore, and could be putting you through more stress than necessary. Now, if you've had any of these tests done, you're not alone. This isn't about blame. It's about reclaiming control. I want to make one thing clear. Always speak with your personal doctor before making decisions about your care. But it's okay, in fact wise, to question routine. Because your time, your peace of mind, and your energy are too valuable to waste. Type yes in the comments if you've ever felt overwhelmed or pressured during a doctor visit. Or type a no if you feel totally at ease with your current care. I read every comment. Let's start with the first health screening that's become more risky than helpful for many men over 60. First up, the PSA blood test. Now, if you're over 60, chances are high you've had this test maybe more than once. PSA stands for prostate-specific antigen, a protein made by your prostate gland. Higher levels can be a sign of prostate issues like cancer. But here's the truth most men never hear. A high PSA level doesn't always mean cancer. And a low PSA doesn't always mean you're safe. See, as you age, your prostate naturally grows. It's part of life, just like graying hair. And that growth can raise PSA levels even if there's no danger. But many doctors still treat a high PSA like a red alarm. That can lead to unnecessary biopsies, painful invasive procedures with real risks, overdiagnosis. I've had men come into my clinic terrified, convinced they were dying, when in reality their PSA was just slightly elevated from normal aging or inflammation. And here's the kicker. One study published in the New England Journal of Medicine found that for every life potentially saved by PSA screening, nearly 50 men underwent harmful procedures they likely didn't need. It's not that the PSA test is useless. It has its place. But it should be used with context, not like a red stamp of doom. So what can you do instead? Focus on the health of your prostate, not just the numbers. Eat anti-inflammatory foods like cooked tomatoes, avocados, and pumpkin seeds. Avoid excessive dairy and processed meats. Move your body. Daily walks support circulation and hormone balance. Reduce stress. Chronic worry can inflame your entire system. And if you do get tested, ask your doctor about your free-to-total PSA ratio and how fast your levels are changing. Those give a clearer picture than one number on a chart. Gentlemen, knowledge is power. And sometimes less testing means more peace. Next on the list, colonoscopies. Now, don't get me wrong, colonoscopies can save lives. For many men in their 50s or early 60s, they catch early signs of colon cancer before it spreads. That's a good thing. But here's what your doctor might not tell you. If you're over 75 and have had multiple clean colonoscopies, the risks may outweigh the benefits. Let me explain. Colonoscopies aren't simple tests. They require anesthesia, bowel prep, and they carry real risks like internal bleeding, perforation of the colon wall, complications from sedation, especially if you have heart issues. I've had men in their late 70s come in after a routine scope, only to end up hospitalized with infections or heart rhythm problems triggered by the stress of the procedure. Preventive Services Task Force, a major authority in health, recommends stopping routine colon cancer screening at age 75 for men who've had no prior issues. Why? Because most colon cancers grow very slowly. If you've had clean screenings, the odds of sudden trouble are very low. So what's the smarter strategy? Think vegetables, lentils, ground flax seeds. Drink plenty of water. Stay regular. Constipation stresses your colon. Consider non-invasive tests like FIT, fecal immunochemical test, yearly instead of a full colonoscopy. And always talk with your provider. Ask, do I really need this scope? Or are we just following habit? Remember, just because something is routine doesn't mean it's right for you. You deserve personalized care, not a one-size-fits-all checklist. Let's talk about one of the most misunderstood tests for men over 60, testosterone screening. Now, I know the appeal. You're feeling tired. Your drive is lower. Maybe your muscles aren't as firm as they used to be. A doctor runs a quick blood test and says, "Looks like your testosterone is low. Let's fix that." Sounds like a simple solution. But here's what they don't tell you. Total testosterone levels naturally decline with age. And that's not always a problem. What matters more than the number? How you feel, how your body functions, what your free testosterone, the active form, is doing. But many clinics only check your total testosterone without context. I've seen too many men go down this road, chasing energy and intimacy through a patch, gel, or shot, only to feel worse in the long run. Here's the better path. Boost testosterone naturally by building muscle through strength training. Eat more zinc-rich foods like pumpkin seeds, chickpeas, and oysters. Sleep 7 to 8 hours. Deep rest helps regulate hormones. Avoid belly fat and sugar. Both increase estrogen and throw off your balance. If you truly suspect a hormone issue, ask for a comprehensive panel. Total testosterone, free testosterone, SHBG, sex hormone-binding globulin, and estradiol. And make sure your symptoms, not just numbers, guide your treatment plan. Gentlemen, testosterone isn't about youth or vanity. It's about balance, strength, and clarity. You don't need synthetic shortcuts to feel like yourself again. Here's one you might not expect. DEXA scans, those bone density tests commonly used to check for osteoporosis. Now, you've probably heard how important they are for women. But for men? That's where things get murky. Osteoporosis does affect men, especially past 70. But here's the catch. Routine DEXA scans in men over 60 often trigger unnecessary medication for mild bone thinning that would never cause problems. Let me explain. These tests measure something called T-scores. If your bones fall just a bit below a certain line, you might be labeled with osteopenia or even osteoporosis, even if you've never had a fracture or symptom. What happens next? You're prescribed bisphosphonates, drugs like Fosamax or Boniva. And here's where the real concern begins. These meds may weaken your jawbone over time, a rare but serious condition called osteonecrosis, cause severe digestive upset, lead to strange thigh bone fractures after long-term use. I've had patients come in with more discomfort from the treatment than from any bone loss. Some couldn't sleep. Others had aching limbs. One man even developed swallowing issues from the pills. So what should you do instead? Focus on functional strength. Weight-bearing movement builds denser, stronger bones. Eat calcium-rich whole foods, like leafy greens, almonds, and sardines with the bones. Get enough vitamin D, either from sunshine or a quality supplement. Use balance training, tai chi, gentle yoga, or standing on one leg while brushing your teeth. And most importantly, ask why you're being tested. If you've never had a fracture, have strong mobility, and feel steady on your feet, a bone scan may not tell you anything new. Gentlemen, you're not just numbers on a chart. You're living, moving, breathing men. What matters most is function, not fear. Let's finish this list with a test nearly every man over 60 has seen. The EKG for electrocardiogram. You know the drill. You lie back. A nurse attaches sticky patches to your chest. A machine spits out a graph showing your heart's electrical activity. Seems harmless, right? Well, not always. If you've had symptoms like chest pain, shortness of breath, or irregular heartbeat, then yes, an EKG can be helpful. It can detect heart rhythm problems, past heart attacks, or certain conditions. But here's the truth most men aren't told. Routine EKGs in healthy, symptom-free people over 60 can lead to a cascade of unnecessary follow-ups, stress tests, angiograms, even surgery. All because the machine saw something abnormal that might not be abnormal at all. Here's why. As we age, heart rhythm changes slightly, that's normal. Past illness, high blood pressure, or even athletic conditioning can cause variations. These variations often look scary on an EKG but mean absolutely nothing. But once that report shows a blip or irregularity, you're sent down a road of tests, copays, worry, and possibly even interventions that carry risks of their own. I've had patients who were told they had heart problems based on one EKG, only to discover months later that everything was fine. Here's what I recommend instead. Know your symptoms. Do you have chest pain, dizziness, or shortness of breath? That deserves attention. Focus on your real risk factors. Blood pressure, cholesterol, blood sugar, waist size, smoking history. Support your heart naturally. Daily walking, leafy greens, omega-3s, and meditation all strengthen the heart without machines. And if your doctor suggests an EKG out of routine, ask, what are we looking for? And what will we do with the results? You deserve to know the plan, not just the process. Let's pause for a moment and recap. You've now learned about 5 common health checkups that many men over 60 go through without question, but that may be doing more harm than good. Here's your list. PSA blood tests often trigger fear and invasive procedures, even when no cancer is present. Colonoscopies after 75 can carry real risks with little benefit if you've had clean results. Testosterone testing leads many men down the path of artificial hormone replacement they may not need. Bone density scans may cause unnecessary prescriptions for minor bone thinning that won't harm you. Routine EKGs often detect benign variations that lead to expensive, stressful follow-ups. Now, I'm not saying these tests are evil. They each have a purpose when used wisely. But the truth is this: your body is not a checklist. Good care isn't about how many tests you've had. It's about why you had them, and what they actually tell you about your health, your life, and your future. So what can you do? Start by asking better questions. Here are 3 to keep in your back pocket at every doctor visit. What are we hoping to find with this test? How would the results change what we do next? What happens if we don't run this test? That single question stops the momentum of fear. It makes your doctor pause. It brings the focus back to you, not the system. Because if the answer is not much, then maybe, just maybe, you don't need it. Step 4. Replace fear-based tests with daily self-checks. Monitor your balance. Can you stand on one leg for 10 seconds? Check your memory. Recall 3 words after 5 minutes. Watch your mood. Are you laughing, connecting, feeling seen? These checks cost nothing, and they catch real changes long before machines do. Share your story in the comments. That's where healing begins, not just in the body but in the soul. If this video made you feel seen, heard, or stronger, share it with another man who needs it. Your voice might be the one that helps him feel less alone. And if no one's told you this lately, you're doing better than you think. One step at a time, you're building a future you can be proud of. Hit like if this helped. Subscribe if you want more guidance like this. And leave a comment. What's one test, habit, or thought you're letting go of starting today? I read every single one. Take care of yourself, brother. You've got this. Dr. Claire Morgan.